Joe and Kay. This is our second lovely episode.
Yes, and you can visit us on Instagram. We have a funny page going on there. And please subscribe to our podcast.
Absolutely. So last episode, we talked about our pregnancies and how different they were.
Yes.
So now I want to talk about birth because we've both given birth twice.
This is true.
And we know all births are different.
Mm-hmm.
So my birth, I know they're quite a bit apart in age, and I think yours are too, right?
Yes.
Your daughters?
They are 7 years apart.
Yeah, mine are 6 years apart.
Mm-hmm.
So we got that going for us.
Yep.
And then my son, he was born like a month early. So he was at the hospital, all natural birth. And then my daughter was born at home in a home birth, all natural.
Mm-hmm.
Great experiences.
Mm-hmm. And did you have midwives for both of yours?
I had a regular OBGYN doctor with my son, and then I had a fetal specialist and a midwife with my daughter.
Okay.
What about you?
Well, with my daughter, my first daughter, she was actually like 13 days late. I had her in the hospital. I was determined to have an all-natural childbirth.
Yeah.
Like, I practiced the Bradley method. I'd done everything I possibly could.
I don't even know what that is.
It's like breathing and, that vision, having visions in your head. It's beautiful. It's beautiful. But that did not happen. And I got Pitocin without an epidural. Ugh. If anyone's ever had that, it's kind of crazy. And then after 36 hours of being in the hospital in labor, I had made no progress. So I had a C-section. And then with my other daughter, I did have a midwife, but that did not work out. And I actually let a midwife group go because I did not like... I think that's really important, and I think it's important for women to know they can do that. If you don't like a doctor, and as a therapist, I tell people they can fire me all the time.
I was going to ask you if you liked your doctors, because I didn't always have good experiences, and with my son, I didn't really know that you could like fire a doctor until I did it, and it was really liberating, and then I got a whole brand new doctor. And I just feel like when you're going through the most emotional time in your life and the craziest time, and for me, the sickest time of my life, because my pregnancies were so horrible and so extreme. And then the end result is like, this level 10 trauma on your vagine. Like, you really need the most support and somebody who you can like actually talk to and not mind being in the room.
Yes.
And I think some women have like these really horrible experiences, or their doctors didn't listen to them, and not having the courage or even just the know that you can literally fire your doctor and ask for a new one. Yes. No big deal.
Yes.
Yeah.
And there were things I asked for. Like I said, well, do I really have to be tested for gestational diabetes, or can I just go on the gestational diabetes diet with my second daughter? Because with my first, I didn't have it. Yeah. And I don't feel like drinking all that sugary syrup's really good for your fetus. But I'm not a doctor. So they got really worried. Just because I was asking these questions. And I think it put them on high alert, and then it just got awkward after that. And then I went to my next midwife, and at one point I was telling her something I read on the internet. And she said, oh, well, we all know, in a very sarcastic way, we all know that Dr. Google knows everything.
Oh, Dr. Google.
Like, oh, okay. And then every time I went and saw her, she kind of talked down to me a little more every time. Yeah. And I thought, no thanks. So then I switched to a doctor, and I was really happy I did. And it was more of the experience I wanted. And I ended up having another C-section, but it was way better.
But what's funny is I know that with our second, we both had the same doctor, and we both had a really great experience.
And this was before we knew each other.
Yeah. It was just in conversation that we realized that we had the same doctor.
Yes.
Yeah.
And I before then I had said that I only wanted female doctors, And this is an older man, and he had a really good sense of humor. He got my sarcasm.
That's exactly why I really enjoyed having him as my doctor, because he really took his time. You know, most doctors are like, oh, question, hurry up and get out of here.
Yeah, get out. Someone's waiting.
He literally was like, how are you? And like, I could be like, well, I completely feel like shit. I want this baby out. And he'd be like, yeah, that's normal. So how else is, what else is going on or whatever? Or I could cry and he would hand me tissues and not even like think anything. And we were going weekly for ultrasounds just to make sure that my baby was still alive and breathing and doing well. And that was something that he set up. Well, he had gone on vacation. I had to see another doctor in his practice. And every time I asked him a question, he was literally like, well, I guess that's up to your doctor. You're not my patient. That's not my opinion. And it was super like, well, what I was a little irritated about is I thought I had a good relationship with the nurse in their office. And she totally told that doctor everything that I said. And then at my next appointment when he was there, he refused to come into my room. And I just had like a nurse visit. Yeah. I'm like, oh,
you have
girl,
to be careful.
Drama at the doctor's office.
What did you tell her?
Nothing.
What did you say to the nurse? Like,
well, my husband went to all my appointments with me, so it's not like it was just me. And he was like, yeah, I just didn't like how he talked to her. And, she was really trying to ask questions. And he just kept saying like, well, I don't know. I'm not, you're not my patient. That's not my opinion. You'll have to that's between you and your doctor. And it's like, so what are you... what are you even doing here? I don't even need you. And I'm like, if I really don't need to see him. So she told him, and he was getting ready to come in. And then she came in and was like, actually, he just realized what patient you were and things that were said last time. So he's just not going to even come in today.
No.
Yes.
Snitches get stitches.
Right?
Did you bust her face up afterwards?
I thought this was like HIPAA compliant up in here.
Yeah, no, just they can talk amongst themselves, I guess. Yeah.
Apparently.
Yeah.
So then that doctor never wanted to see me.
Oh man, you're rejected.
And I did fire one other doctor in their office before I got to the good doctor. I was referred by my midwife because I was having at-home IVs and we needed to be set up on a regular schedule. And the only way to do that was through a maternal fetal specialist. So I got to him, and literally the whole appointment, all I could think about was he was smiling the whole time with these big veneers.
Oh gosh.
And like I'm crying my eyes out, and I'm like, I don't know if I could do this, like ugly cry. And he's literally like sitting there typing with like this big old smile on his face. And I literally asked him like, why are you smiling? Like, I just need you to say something to me right now. And he's like, well, how about I just give you a week's notice off of work and you can get some rest. And I'm like, I'm literally dying right now. I don't need a week off of work. Okay. So I said, bye, girl, bye. You're gone too. And then when I got my good doctor, and he took care of us really well.
Yeah. And I did not want a C-section with my first daughter, and I really wanted a VBAC with this one really badly, because I had to mourn the loss of that. And I think that needs to be acknowledged that, when people aren't planning for a C-section and you're kind of forced to have one, that's hard to handle. Horrible. So then I got gestational diabetes. I did end up getting the test.
Way to go.
Yeah, I know. And I heard it's all about the placenta, that it's not due to weight. It's not due to, I think there's all these misconceptions about gestational diabetes. But, and then I got preeclampsia, and I had to have her a month early.
Yeah.
And luckily she didn't go to the NICU, nothing like that. But, I put my brave face on, and I was sitting there on the table getting my epidural, and I started crying. Like, I was looking down, like trying. I know, it was very sad. I was just very emotional, as I think anyone would be. And he just reached over and grabbed my hand. It was just the sweetest thing. And it's exactly what I needed at that time. Because when that's going on and your husband can't be in there.
I know.
No one can be in there when that's going on. So
he's a great, amazing
he was very
doctor.
Sweet. I don't know
so
if we
sweet.
can like say who it is, but anyway,
Probably not. Shout out to you. You know who you
yeah.
are.
And I've heard things that he's like really funny, and like when people work holidays, he brought in Starbucks for everyone who was working there.
That is so true.
Very sweet.
He's a really sweet doctor.
And I think that it's important for all of us who are working in an office setting, you know, to try to make your office a more fun.
I completely agree.
Place to work.
Because I know a bunch of negative Nancy's. And it can really just bring you down. And when you're like at work, you need that, you know, good environment going.
Yeah, working with people. It's hard.
I know. It
so
is.
Just laugh.
Yeah. You know what? You just made me think of something. Knowing that. So both of us have had kids in our deliveries, and we've had 3 very, you know, different births, a hospital setting, a home birth, and a C-section. And it's funny how moms can be judged no matter how you have your baby. Yes. You're judged if you had an epidural. Well, I did it all naturally. Or you're judged if you do it naturally, because then, you know, why would you do that? Because there's modern medicine and you could have just saved yourself the pain. Yes. Or then you have your baby at home and they're like, oh, I would never put my baby and myself in that kind of danger. And then if you have your baby at the hospital, then they're like, oh, well, I had my baby at home because I would never put my baby in that kind of danger. Yes. And then you have a C-section and it's like, oh, well, that's not a real way of giving birth. Yes. It's like, can we stop the madness? Yes. For real? Yeah. Because now it's out of control at this point. It is. Yeah. And the whole breastfeeding issue, which we'll talk about next time too. But, you know, it is. There's so much judgment. Yeah. And not enough, like, there needs to be more mom love. I agree. And I think it's okay. And I know I have strong opinions about things. But even though I have strong opinion about something, it doesn't mean that I'm like negatively going the other way. Like, I'm a huge breastfeeding advocate. I breastfed both of my babies. I would, like, it would be my worst nightmare to have to give my babies formula. But it's not the formula. It's the, like, I just want my body to do what I think my body needs to do. And it's that perfectionist in me. Yeah. Like, I should be able to do this. But just because you formula feed, or you choose to formula feed, and you choose to not have your boobs look all weird or get engorged and go through the pain, like, I'm happy for you. Yeah, and I think my last job was in infant mental health. Yeah. Where I'm working with moms like right after they've given birth up to the time their kids are 3. And there's so many moms that actually did try really hard. Yeah. And just hearing their stories, you know, having to keep it together was hard. Because you know that they want so badly to do, you know, what they've, you know, what they feel like they should be able to do. And that's back, and if you look at the history of breastfeeding, there are people who just wet nurses, and there were wet nurses, exactly. Which I kind of want to sign up for that job. We'll talk about that. Just being a wet nurse, and I was a good milk producer. In other cultures, that's acceptable, right? But I offered, like, my friend, you know, we had babies around the same time. I was like, hey, and she couldn't breastfeed, and I was like, hey, how about, you know, I could do it. Yeah, I've donated plenty of milk. No, I was like, let me breastfeed him. Yeah, and she's like, no, that was a little weird for her, and that was fine. I totally understand. But I was like, at the time, I was like, oh, you know. Oh my gosh. I want to breastfeed everybody. Okay, so what is, like, 2 or 3 things that happen with your body or your body did after birth or during pregnancy that nobody warned you about? Oh, this is a good one. Let me tell you. It's during birth, actually. All right. So they break your water. Did you poop? No. Okay. No, because I never pushed. Yeah, that's true. C-section. Okay. So they broke my water trying to get, you know, with my first daughter. Yeah. Trying to get everything going. And I did not realize that then the water has nowhere to go. There's still fluid in there. So it goes everywhere. Like, I stood up to, like, get in a better position, and I was just like, what? It's not a little stream. It just keeps going. Yeah. And it doesn't stop once they break it. It's not like it's all gone. No. It just keeps coming out. So that was a gross thing that no one warned me about. Yeah. And then I'll think about it. Do you have any? What do you have? I think mine was like Oh, nobody warned me in birthing classes or like even other moms. It's not necessarily birth, it's after birth. Like when you're nursing, how gross your bra stinks or your boobs smell when you wake up from like the spoiled milk, or like when you leak out and you literally just kind of smell like rancid milk.
Yeah.
And that really grossed me out. And then I was afraid to be like, I think my tits kind of stink right now.
Like, do you smell that?
Do you smell
That's
that?
me.
Those are my rancid tits. Like, nobody talks to you.
No.
Or tells you those weird things.
Mm-mm.
And when I see pregnant women, they're like, let me tell you a little fun fact. And then I think I scare them. But I just really want them to know, like, your body's about to do some really weird things, and that's okay. Yeah. And just let it do its thing.
And everyone's different. Everybody's bodies. Like, I don't really leak.
Oh, you don't?
No.
I did in the beginning until I got, like, adjusted to it.
Mm-hmm.
I remember when my milk came in for the first time and it looked like somebody poured, like, water all over my shirt, and I didn't even realize it. I just looked down and was, like, soaked all over the place. And I'm like, oh, milk arrived. Ding, ding, ding. We got a winner. And I was, like, covered in milk, and then I just couldn't make it stop going. Then you put those little pads in there, and those are disgusting.
I've never had to do that.
So. Oh, that's a whole other thing. Oh, you use disposable pads? Oh, I would never put that on my nipple. And then they have like washable pads, which I think that's even like grosser, because your breast. That's another one is breast milk. It like stains your clothes. It's like greasy, oily, and you can get like breast milk stains.
Well, that makes sense because of the fat content.
Yeah,
I never thought about that. It
totally stains your clothes.
You could probably yours probably has a really high fat. You could probably make butter.
You know what? It does separate, and it got really thick at the top. I did have really fatty milk. They're
making like breast milk ice cream now, and they're accepting like donations. So
well, I'm not nursing anymore.
Well, I know.
But that would have kind of been good.
It's not donations; they pay you.
Yeah. Has your husband ever tasted your breast milk?
Of course.
Really?
Yeah.
My husband wouldn't do it. He's too chicken.
Oh, really?
I told him it tasted like chai latte. And I almost got him to do it. He totally wouldn't fall for it.
I'm daughter.
Like, no, seriously, it tastes like chai latte.
Yeah. It kind of looks like it.
A little bit.
On the day. Yeah.
I'm like, just try it. And then one time he saw it like pull out of the fridge, and it had like a green, purpley, gray, blue tint to it, because like just how your breast milk can be different colors in the fridge. And mine was always like this gray, green, blue color. And he was like, it's rotten. Don't use it. It's molded. And then there was like thick butter on top. It was not cute. I'm like, no, it's just chai latte. You have to try it.
Just drink up.
Yeah,
what's wrong?
It's totally fine. Don't even worry about it.
Mm-hmm. Yeah, no, my daughter even tried it, and she was like, not straight from the source.
Yeah.
Obviously. Well, but yeah, she was like, ew.
So when I was nursing my daughter and my son got a really bad cold, and she was like freshly new, so I had like a lot of really good yummy colostrum.
Oh yeah.
And I would literally put the breast milk in his oatmeal with butter and berries. And
never know.
Literally, he got over his cold so fast, and I kind of felt like I was poisoning him. Like, did I need his consent to put breast milk? But I don't think so. But I did tell him later on that I had my breast milk in there, and he was like a little bit grossed out, but thankfully not too grossed out, because it was like normal human milk for human babies. You know?
This is right. So how about during labor and delivery, something that your husband did like wonderfully?
I'll just go off the last one, because that was the most recent birth. When you go back too long, it's like you forget about the little things that were really important to you. For him, when I had my daughter at home, this whole perfectionist thing, I remember I had clothes in the dryer, but our dryer at the time wasn't like really working, so you had to do 2 cycles to make sure. And literally all I could think about was I needed to put it on the second cycle, because those clothes were gonna mildew. So I'm like in the middle of contractions, and I'm like, I need the dryer on. And then I got hot, so he pulled out a fan from the bedroom, but then he moved the baby carrier that I had in the living room, and then I could see the indentions on the carpet, and it was like I couldn't focus in my labor, so I had him move everything back to the way it was, and then reposition the fan so that I could just focus. And he never was annoyed or anything. It was just like, okay, my midwife was the one saying, stop worrying about laundry and the way your furniture is rearranged, and please just like get your baby out. So that was good. And he held my hips for me when I was contracting, and that was really comfortable.
Did the midwife tell him to do that?
She did. Okay. So during because I stayed in like the same position, and he would hold my hips, and I guess when you squeeze the hips in during contraction, it keeps the pelvis from stretching out even more, which like kind of is like a natural pain. So it's not like it made all the pain go away, but it definitely like reduced the amount of pressure that was in my hips. So he just kind of stayed behind me and like put all the pressure into my hips and held them together during my contractions. But it's fast. I went from 5 centimeters to delivering in 22 minutes. So there was really not a lot of time to.
Wow. People wish for that. Did you tear though?
Not with her, not in the water. I had no ripping, no anything. That's with my awesome. Son, that was like level 20 trauma on my vagine, front to back. Stitches, ripped staples.
You a new asshole.
Literally.
For real.
Stitches, staples. I thought everything was just going to be one big giant hole together.
Wow.
Yeah, it was. But I think it's because dry birth versus having her in the pool.
That's true. Yeah.
And different positions. I don't know what it was. She was a little bit smaller, but not that much smaller. So I don't know, but the pool birth, that was a way better experience than dry birth. Yeah. I call it dry birth. I don't know what people call it. Water birth, dry birth. That makes sense to me.
Typical versus water. I don't know.
Right? Wet and dry.
Yeah.
So I don't know.
Let's call it dry birth.
The dry birth. Yeah. It was dry. It was awful.
Yes.
Yeah.
So yeah, and I'm trying to think. The one thing that no one talked about was when you have a C-section, they gave you oxycodone.
Oh.
Afterwards.
Were you totally itching all over your nose?
So I don't know what typical reactions there are, but it just knocked me out. So I it was bad. So then I just took ibuprofen.
Really?
Yeah, and then with my next C-section, which felt a lot better because it felt like it was more my decision. Mm-hmm. I didn't want to get induced and have that fail and just be heartbroken, so I just said let's go for it. Then I said, I've done this before. Mm-hmm. Don't give me the really powerful painkillers, just give me like ibuprofen,
enough to take the edge off.
But then they weren't bringing it to me, and they said I had to request it, and I was like, what? I just was cut open. Like, I don't know. So that was interesting. And I fired a nurse.
Did you?
I did. Good. She was telling me that, I could get pneumonia because they had to give me medicine to lower my blood pressure. And so, so there were things I need to do, which I was doing. I mean, I think she was thinking I wasn't doing what I was supposed to do. And so she just came at me full force and was like, and your baby's body weight is concerning. So, you're
all bi negative, Nancy.
Yeah.
I ain't got time for you,
and that's
girl.
exactly what I did. So I said, yeah. And I said, I don't think you and I are communicating very effectively.
Yeah.
That's
good.
And so I talked to her supervisor.
Well?
No, I talked to her supervisor because she did not take it well.
It wasn't when I was pregnant, but I was hospitalized one time with my daughter, and I remember having this nurse, and we got into a conversation, and she literally was like crying on my bedside about like her personal life, and I felt so bad. Like, I know that we made a connection with each other, but then like afterwards, I'm like, that was probably really inappropriate and probably should not have happened.
Yes.
But also, when people realize what you do for a living,
yes,
I think they're way more apt to like opening up to you.
I sometimes tell people I'm in real estate or I sell insurance.
Right. Don't talk about
because they don't want to talk about that. Mm-mm. They don't want me to try to sell them a house or insurance.
I know. Sometimes I just tell people I just stay at home.
Yeah. I don't want to get into it. Yeah.
I don't.
Because it does. It opens up a whole new.
Sell Scentsy.
That's awesome.
Scentsy
I would love
consultant.
to.
I wish I was good at selling because I probably could be.
Yeah.
But I don't think I am. But I love products.
Yes.
I just don't. I get like, irritated with like the whole process of like trying to.
I'm not. It takes a certain kind of person.
Yeah, I'm not.
But
that
I am
person.
not.
I'm not.
Shout out to all you moms out there.
Yeah, who can actually sell things.
Yeah, Mary Kay.
Scentsy, Mary Kay. What's big around here? Advocare, Scentsy.
Pampered
what
Chef.
Is that new with the stickers on your for weight loss?
Oh,
the Thrive.
Yes,
Thrive. All the vitamin cells.
Yes, I can't.
Girl, do you, boo? I can't sell anything.
It would be sad. Like
I'll be like, here's a maxi pad. It works great when you're on your period. Sold. That's about it, as much as my selling point goes. Or like, have a glass of wine before bed, especially when your toddler's freaking out, because it'll make the tantrum easier to deal with. Sold.
Yes, all. We should like make our own brand of like tantrum wine.
Yes.
That's like higher alcohol content.
That would be a really good idea.
We'll talk about that later.
We could definitely talk about that. So let's talk about our product of the week.
Okay.
Do you have a good product you're thinking of?
Yes, actually, I love this stuff. It is a Method cleaner. It is the grapefruit scent, the pink grapefruit one.
Oh, it smells so good. Is my favorite. I know exactly what you're talking about.
And then I also use, when I feel like I need to disinfect, I use the bamboo scent. And it is. And it's, and you can use it on windows. You can use it on anything.
Really?
Yeah, the pink grapefruit.
I love the Method cleaner.
Yes. And so that's what I use, and I feel like
really good.
It does, and I don't feel like I'm poisoning everybody.
Your family?
Yes, but I do use other things when I have to.
I love bleach.
I do.
Like Preston. Yes. My son one time told me like if they had a bleach scented Scentsy wax, my mom would probably buy it, and he's probably right because I use bleach on everything. I'm like, just go get the bleach. Bleach it. Bleach.
Yeah, I'm not a huge bleach fan, but I'll use it.
I love.
I like Pine Sol. The smell of Pine Sol.
Pine Sol makes me. I can't do it, but I love bleach. Bleach you can use on anything.
Yep.
So my product this week is something I've been using for a really long time. I have really sensitive skin, and it's like I get cystic acne, and it's hard to figure out. Sometimes it's too dry, sometimes it's too oily, and I've gone through like a lot of different kind of face washes. So I found these things called scrub buds, and they're silk pods, like silkworm pods, and you wash your face and then you use them on your face, and it like exfoliates, it brightens your skin. They're amazing. So on our Instagram with our products, we will be posting the products that we talk about in a link if we can, if they have a link. And these specific scrub buds come from Beauté Nouveau. It is a woman-owned business pioneering the way. She's a total badass. So Lacey, if you're listening to this, you're amazing, and I'm super proud of you for everything that you've done for your company. And you guys should try these scrub buds out. You tried them.
I did. My husband like felt my face the other day, like yesterday. I used these like 2 days ago, and he like just touched my cheek, and he was like, "What have you done? Did you get a facial?"
I know.
And I said,
it's
no.
Silk pods.
No, and I sent you a text, and you said, for real? Like,
I know, I'm like, are you being sarcastic? You don't have to be all up on my product.
No, it was really good. It was great. So
that's awesome.
And then I have something to confess.
Confess it.
So how about
today's confession?
Everyone get out your juice boxes or your wine or beverage of choice, because
we have confession time.
our mom fail.
Mom fail.
I think that should be the theme song.
Confession time.
It's beautiful.
Mom fails.
Mm-hmm.
Ding ding ding.
Yep, exactly.
Do you want to talk about yours first?
You can go.
Because I got one.
You go.
So I traumatized my toddler this week. We had to go to the bank. She always wants some kind of treat from the bank because I always have something, and I don't want her to eat candy, so I always like opt for a sticker. And usually they give like the little small stickers, but this time they give like this big old honkin' sticker. And so she's in her car seat, and I give it to her, and then we get on the freeway, and she's like pissed that the sticker won't go on her hand because
I
it's
can
like
see
too
this.
big.
Mm-hmm.
And I'm like, well, okay, why don't you just put it on your arm? You know, like kind of fold it on your arm and just wear it like a bracelet. And then that wasn't working. So she's in full on tantrum at this time. And now she's trying to put the sticker back on like the paper that it came on.
Mm-hmm.
Wasn't working. So I'm like, here, let me have the sticker. Just very calmly. She gave it to me. I literally rolled my window down and I threw it out the window. We don't need that stress in our life. She was freaking out. She's like, my sticker! And we kept driving, and I was just ignoring the tantrum. Like, I'm not going to give in. We're not going to engage. I just said, if you're going to get that upset about something, then you don't need to have it. So we get to my son's school, and she's still crying, but in a different cry. And then she says to me, thank you for throwing my sticker out the window. I'm like, yeah, come on, girl. We do not need that kind of stress in our life. We don't.
No, we don't.
But then I thought she was cool with it. And then when we got home, she totally told my husband, like told on me. And then we got in the car the next day and she's like, I don't have a sticker for you to throw out the window.
Because that's a place of the trauma. That's where it happened.
Yeah. So now she's all traumatized. I'm going to throw all our stickers out the window.
Yeah.
But I couldn't handle the tantrum that was coming along with.
No, I think,
and when they're in that point, you can't reason with them when they're still worked up.
No.
So the only good solution is to just separate whatever they're hyper fixating on and get rid of it. And whatever, I failed. I just threw it out the window. Like, bye, sticker.
Yeah.
Plenty of room for you to stick on something else. And nobody's going to cry about it.
There we go.
What does your mom fail?
Oh, mine's a little, so my daughter, she just got over being sick. Like, she was sick like 2 weeks ago.
Kids
so
are
I thought,
sick.
And she's older. She's 9 now. So I thought, you don't need, so she said she wasn't feeling well. And I just automatically went into, well, are you worried about something? Because she does have a little anxiety.
Yeah.
So, and she said, no, I don't think so. And I said, well, does it feel that way? Is it that kind of stomach pain? She was like, I think so. And I didn't, because I didn't want her to stay home. So I didn't want to get into it any further. And I was like, get your ass out of the car.
You're going to school.
You're going to school.
Yeah.
And so I come to get her. And I usually show up like 15 minutes early so I can get on my phone. That's my phone time.
Yeah.
Because I got the baby locked up in the car seat.
Right.
I'm
You're
free.
There.
I am. It is like my moments of freedom. The car is amazing for that.
Yeah.
So I'm sitting there on my phone and the principal comes out. I'm just like, oh, what? Like, what is going on? Yeah. What did I do? What did she do? What's going on? And she said, so your daughter threw up. And we've been trying to contact you for like 4 hours.
Jay.
I know. And I said, okay. And I looked at my phone and I said, yeah, I did miss a call. And it says her school. Like, I just didn't look.
Yeah.
I totally ignored everything on my phone and just wanted to get to Instagram.
Yeah.
That's what happened. And so I did. So my daughter comes out and she's like, like, she looks sick. She's got her bag.
Yeah.
She's like, hey, Mom, I threw up. But I got to lay on this pad in this room for all day. It was so nice.
I want to be in that room when I throw up.
I know. And she said they have like the germ killing, like, what are those? It's the mister.
Oh,
like
I need that.
Yeah, she has. She's like, they put that in there. Mom, it was so nice. And I thought, well, you should just stay at school. Like, don't bring that into my house.
No, you should go back into that room and call me when you're feeling better.
Why am I getting you right now? But yeah, it was that definite guilt, and I was being judged. You know that.
Why didn't you answer your phone?
Yes, like how much
when the school called you? What else could you be doing? Working?
Yeah, well.
What? Taking care of another baby?
Yeah, and that was what I was doing, but I'll have to remember from now on to turn my phone on. But the mom guilt got me a little that day.
One time my son's school called me about him being sick. He gets pretty frequent GI upset, but we have like this code word. Like if he's gonna throw up, he says like my leg is shaky. I don't know why he says that. It's like so It's kind of dumb, but
I like it.
It's his thing. Yeah. He's always said that, so we just go with it. Mm-hmm. And I just became a thing, like, oh, is your leg shaky? And he's like, yeah, kind of. And that means he's going to throw up. So the nurse called me, and she's like, well, I have your son in here, and he's not feeling really well. And I'm like, oh, did you ask him if his leg's shaky? And she was totally like, what? I'm like, just put him on the phone. I'm like talking to him, and we like make our own little plan. And I'm like, okay, put the nurse back on the phone. I'm like, okay, here's the deal. He's gonna lay down for about 25 minutes. If he tells you that his leg's shaky, he's probably gonna throw up. So give him a garbage can. In 25 minutes, if he wakes up and he feels totally fine, he's gonna go back to class. He'll be good. If not, give me a call. I'll come pick him up. She was like, oh, okay, thank you. And we were done with that.
Well, wow, it's amazing what happens when you answer your phone. I'm glad that that sounds great. Like, I always tell parents that have kids that get sick to come up with a code and do.
You have like a safety plan.
Yes.
I think I'm used to like safety planning for work. Then you have to do it for your kids.
Yes.
Like, here's the deal.
Mm-hmm.
Remember that plan we talked about? We're putting plan A into action right now. Call me if your leg's shaky. Go take a 25-minute nap. If I need to come pick you up, I will. Boom. Done. Crisis diverted. No puking kids today.
Isn't it great? Right. The days where your kids don't puke.
For real.
Yeah.
That's never going to happen. But, yeah. Oh, we could talk a lot about puking kids. Probably somebody would, like, think I'm a horrible parent when they know what I do when my kids puke. But I'll leave it suspense for another episode.
Yeah, we'll talk more about that later.
Thanks for listening. We will post a link for this so you guys will be up to date with all our podcasts. Follow us on Instagram.
Subscribe
to us. And message us with any questions you have. And again, we're going to post a link for all our products that we have. And we will be responding to emails or messages, whatever you want to do. We would love to interact with you.
Yep. Thanks for tuning in.
Have a great day.